Hi, everyone. Today, I'm honored actually to have Dr. Khurrum Khan with me for a interview. And just to give you a brief introduction, I think we can go in much detail regarding him, but he's an oral and maxillofacial surgeon. And if I'm not wrong, he's actually one of the first Pakistani dentists who actually migrated, did an advanced standing program, got into an oral and maxillofacial surgery program, and then he continued to do further fellowship like in cleft and lip palate reconstruction. He's also known as an orthognathic surgeon. He served in the US Air Force, and there's much more to him. So I'm glad to have you, Dr. Khurrum Khan, and thank you for your time. It's actually an honor.
Nee, it's an honor for me. Thank you so much for having me. I'm really happy to be here today to talk about or answer any of your questions. So I'm very honored to be here.
All right, sir. So we're gonna jump start and talk about, like, for most people who are watching this video, and I hope most are dentists, but people know what a dentist is, and then they know a little bit what is oral and maxillofacial surgeon, and mostly they think, oh, third molars. That's the main thing that comes to their head. But as far as I've experienced or seen, it's a very big specialty. So can you help us or tell us what it actually is, specifically in US?
Absolutely. So oral and maxillofacial surgery is a specialty in dentistry. Um, just like orthodontics or periodontics and endodontics, there's multiple specialties in dentistry like you have in medicine. So oral and maxillofacial surgery is one of those specialties. We're specialists in the head and neck region. So whether that's removing wisdom teeth in the oral cavity or placing dental implants in the oral cavity, or the maxillofacial region, which is the head and neck region, whether it's cancer, whether it's facial differences or deformities, um, anything, or trauma surgery, we do it all, including TMJ, internal derangements, and uh, total joint reconstruction. So everything in the head and neck region.
So, sir, if most people don't understand what I just said, like Dr. Khurram Khan, similar to what I've gone through, like he did his dental school first in Pakistan, which was a 4 years program, and then he did an advanced standing program at BU, Boston University. So, sir, were you planning to be an oral surgeon from early start on when you like were in your BDS in 2009?
Yeah. So I did my bachelor's in dental surgery from Karachi, from Buckeye Medical University. Really proud of that. I love Pakistan, love Karachi, so miss it a lot. So definitely, I am what I am today because of Buckeye. During my time in Buckeye, um, I think it was my third or fourth year when I had my rotations in oral surgery. That is when I decided I wanted to do maxillofacial surgery. Um, Now, oral and maxillofacial surgery, sometimes I say maxillofacial surgery, sometimes I say oral surgery, but I just want to make sure that the viewers do get that. But so it was in my fourth year that I decided that I would like to do this and I wanted to pursue it in the United States.
So, and when you moved to Boston, when you moved to US and you got into advanced standing program, were you doing any rotations, externship during your advanced standing program? Like I know you kept your grades good and you were doing good in academics, but did you do something more than that to get into a residency back then?
So what happened, my story is that I had my interview at Boston University on January 4th. I landed in the US on December 31st.
Oh, wow.
So I didn't have a chance to do anything. The only thing that I did was I gave my national board part one and my national board part two at that time. And then I had also a house job in Karachi. That's all I had. I interviewed on January 4th at Boston, and I got admission there and then. They
Okay.
offered me acceptance there and then. So that's really all that happened with me.
And during your, so pretty much this was your first cycle. You just got to US, you applied to a school, and you got in right away. Correct me if I'm wrong.
Yes,
That
that's
that that's amazing, because usually it can take it. I know people like it can end up 3 years, 2 years of struggle just to get even an interview with the dentist school. But sir, how about when you were in Boston studying, doing your DDS program? Did you do any rotations, externship, or were you getting yourself acclimatized to the oral surgery department up there?
absolutely. So I think if the viewers have to understand this, you have to have a goal, and you have to constantly make sure that you are moving towards it. So during my 2 years in Boston, I did do some externships. And I did them locally in Boston at Boston University and at Tufts. Financially, I couldn't afford to go anywhere else for externships. So it was only those two universities that I did externships at. Um, and if for anyone who's really interested in pursuing, I would tell them to make sure that you do a lot more externships.
And I really admire your honesty, because as an immigrant myself, like when you're studying in a dental school and going for an externship to a different city, right now it's like paying for a week for a hotel cost, the airline cost, and it's quite expensive. And it's really, I would say, inspiring that even though with all the financial constraint, you got where you wanted. And just for the viewers to know, like how many years you have been in training after your DDS, like just in the
Um,
oral surgery realm?
so after my BDS, 2 years of DMD at Boston University, 1 year of internship in oral surgery at Louisiana State University. So that's 3 years. 4 years of residency at Indiana University in maxillofacial surgery. So that's seven. Um, After that, I self trained myself with the help of proctors in cosmetic surgery of the face and head and neck region. And then that lasted maybe about around 4 years, and then during my military career. And then finally, I did a fellowship in pediatric and cleft and craniofacial surgery.
So this is like, this is quite a journey, and trust me, you don't look that old as compared to the amount of years you just mentioned. Here's a question from a student, and I have my own observation, but if I'm a dental student and I'm coming for an externship, and usually for people this is the first time they are going to a surgery department, and the environment is very different to what they see in a dental school, what advice would you give them for getting the best out of their externships?
Be prepared. Um, Make sure you're prepared to work very hard. Put your best foot forward. They want to know how dedicated you are, how hard you can work. And if somebody tells you to do something, do it. Before they even ask, volunteer to do it. This is during your externship. During your externship. If you have to stay up all night for one whole week, do it. They themselves will tell you it's too much. Go to sleep. Go to sleep for 3 or 4 hours, come back, and then we'll work. But you have to show your dedication, because if you are, again, coming from another country, from a foreign country, then the expectations are higher.
Makes sense. So here's a, I'm gonna push the, I'm gonna ask the surgeon in you. Like I've been in externship rotations different, and sometimes there will be one dental student who's being over efficient. And specifically, if you're in OR and you see this new person and he's trying his best, but he might be being over efficient, does that could be a problem for a dental student, because people get very energetic being in that environment, seeing blood and flesh for the first time.
Right.
So what's your advice on the other end?
Oh, absolutely. You have to be humble. Do what you're told. don't talk too much. Do what you're told. That's what it is. It's nobody wants a know-it-all, and that's the biggest thing. They don't appreciate that. They appreciate somebody who can take orders. Remember, at the end of the day, at that point, you're the most junior person there. All they want to know is, can you follow orders? Can you work as a team? They don't want to know how smart you are. They will ask questions, and if they ask you questions, you answer them. Otherwise, be quiet.
That's what I wanted to like. I this is a very important advice, and I asked one of my surgery faculty before going for an externship rotation. He said, "Keep your mouth shut and do what they tell you." Specifically, when you're like the lowest in the hierarchy, they don't want to listen to you until you're asked something. So, thank you for sharing that. And my next question was, Doctor, that so you went through this training, and did you did your internship year at LSU, and then you went to Indiana University for 4 years of program. How did the internship year prepare you or help you to get into a residency and become a better oral surgeon?
It was huge. It was instrumental, especially coming from a large volume, world-renowned program like LSU. I was well equipped to do what I needed to do, and I was also well trained to make sure that I did as I was told. Again, it's so important to understand this. Um, when you interview, and at the end of the day, it's all about the interview. Whether it's for your advanced standing program, your DMD, DDS, or international, whatever you call those programs. Every university has another name for those programs. Whether it's for advanced standing program or it's a specialty, the interview is the only thing that matters. Yes, your grades are going to be good, but every other individual, their grades are phenomenal too. So we're all in the same playing field. It's how we interview gets us the position. So as far as coming back to your question, LSU really prepared me well, because during my interview, I specifically told them, "You tell me to stand on my head, I will stand on my head. I I follow the rules. I will do as you're told. I will do as I am told, and I know what I'm getting myself into." One of the key things that interviewers look for, and I might be jumping, and these questions you may already have, but one of the things that interviewers look for is, what do you know about oral maxillofacial surgery? Do you have any idea what it is? Do you know how hard it is, and how hard we have to work? Because they're scared of taking somebody that will quit. So they don't want anyone to quit.
And sir, one of the things I've personally experienced after, so I spent a little bit time in oral surgery in Pakistan, but the surgery environment in United States way more tough. Like during my externships rotations, the residents hardly sleep. They are always on the call. And I think personally in US, employment is so expensive that the resident is the nurse, he's the ward boy, he's the doctor, he's the like he's doing 7 things at one time and keeping up with the legal system, the notes, everything, consoles. So when you move from your dentist school for the internship year, that's quite a jump. Like, right, because dentist school, at least you get your sleep. How did you how did you manage that, because it's a big leap, like you're not sleeping at all, you're trying your best, you want to get in, you're proving you're an immigrant, you're like there's a lot of fights you're fighting at the same time. So how was that change? And you even moved your city, right? You went to a different city.
Right. Um, you know, from the perspective of an immigrant, it's just sheer determination. I have to be better than everybody else. I have to work harder than everybody else. It's just that I don't have a choice. I was never given a choice. I never gave myself a choice. I always told that I have to be better. I have to work harder. I have to know more. And if you really want it, you will do it. But I agree with you. The jump from dental school to oral surgery is very huge. And that is why people will quit in their first 3 to 6 months. They will quit. So that's something very important. Again, it's just sheer determination, because you will feel like you're drowning because you don't know any of these things. You have to learn a mile a minute, and you will feel like you're drowning. So it's about survival of the fittest. You have to decide whether you want to sink or swim.
And viewers who are listening might think the terms that we are using, the hardship of residency, this is not an exaggeration. I just saw a glimpse of it. And trust me, if you stay up for 1 day, 2 day, that's fine. But for years, like you hardly sleep for just a couple, like 3, 4 hours, and then you're getting calls and you're running. And there's a lot of stress that you're dealing with day and night, and especially if you're working in a trauma center. And I'm gonna tell people something. I went to University of Cincinnati for a rotation, and at that time I told them, oh, I'm going to meet Dr. Khurrum Khan. And the residents, all of them, like even the PG4, turned their neck and said, you know Dr. Khurrum Khan? I said, yeah, he's from the same country I am. They're like, oh, do you know how much of a big surgeon he is? I was like, and that's when I realized like what Dr. Khurram Khan is in Cincinnati area, like how people respect you for the work that you have done. So the reason I'm mentioning is that when you're saying it's pretty hard, as a grown up, like I'm in my early 30s, and still it's very tough when I see it. So doctor, my next question was that, does things get better as you move forward from PD 1, 2, 3, 4?
It depends on program to program. But in reality, no, it gets tougher. It only gets tougher because you have more responsibility. And the way it works, the culture of residencies is that, well, if you're the senior resident, then you're responsible. And
Yes.
if you're the chief resident, then you're even more responsible. So at the end of the day, your intern or your first year makes a mistake and you're the chief, it's going to be your fault. So it becomes tougher. There's definitely more responsibility. It is extremely hard work. And I think it's really important because a lot of people who come here as immigrants and want to pursue this, some of them are married. So I always tell them this, that this is a conversation that you need to have with your family, specifically your wife or your husband, um, and let them know that this is how it's going to be. And they may not see you for a long time. I averaged about 120 to 130 hours a week for 5 years straight.
Wow. And people who are outside of US, like spending 10 hours, like the work ethics in US, like if you're working for an hour, you don't look at your phone. Like the 40 hours spent in work life in US is far more stressful than I was living in Pakistan. Like in other countries, if my mom is sick, I can still call, I can go out, smoke a cigarette, something like that. But up here, when you're sticking to the clock, you have to like be there 24/7. So that's pretty tough. So my next question is, how do you manage, like when you're so much stressed and you're dealing with uh there's a lot going in a hospital, you have your professors, attendings who are treating you differently, all of those, doesn't that seep into your personal life? Like how do you manage that stress?
Uh, it's hard. It's hard. It definitely does seep into your personal life. And this is why you need to have an honest and open conversation with your family members, whether it's your parents that you're living with or with your spouse. If they don't support you, it's going to be a struggle. It is going to be a struggle. If they don't support you, you cannot do it on your own. You need support. And I always noticed the residents who were single, they had a tougher time because they didn't have family support. They would get lonely. It was very rough for them. But then at the same time, I know many residents who ended up with divorces too. So eh, make no mistake that it's a sacrifice that you're making. It is definitely a sacrifice that you're making, especially if you have children. But you can do anything you want as long as your heart's in it. And of course, you have the support. The family support goes a long way. I'm not here. I would not be here today if it wasn't for my family, specifically for my wife.
So one of the things that you taught me when I met you in Cincinnati, you did tell me like every center varies a lot in the kind of training you get. And you mentioned that centers specifically mostly in southern area of United States have vast more exposure to trauma, and there's more complex cases being done as compared to other places. How, can you share a little bit about that? How centers vary comparatively, and the exposure you get is very different.
Sure. I mean, it's very similar to how the American culture is. If you go to the East Coast and the West Coast, it's a more litigious society. In the southern part of the U.S., it's not as litigious. So uh, when you're in an area where you're not really allowed to do too much without getting sued, maybe your exposure may be a little less. And you may have more exposure to more of an academic environment where you have the ability to write papers and do research, but not as much as what you may be able to do as a younger first year or a second year in a Southern program. So.
So that, in a nutshell, people who are listening to this, and that's one of the advice Dr. Khan told me to. If you want to get good exposure, even during your externship, go to bigger centers in the South, because that's where the hard-hitting trauma is. You can see more, you can learn more. Maybe if you're lucky, you can get more hands-on exposure. So LSU is one of the programs where you can see a lot of things as compared to other programs. So my other question you were meant, and I wanted to ask you, and most people think surgeons are people who are nerds, good, doing really good in their academics, studying books all the time, and they are like bookish or bookworm kind of people. That's like they are the toppers of the class. But I personally, from my experience, I've seen there are always variations. But do you think how much does GPA matter, and your personality and extracurricular activities matter when you're pursuing surgery?
Excellent question. Very good question. So of course you have to get an interview first. To get the interview, you need the grades. So oral maxillofacial surgery is a very tough specialty to get into. There are about maybe 100 programs in the country. On an average, if you average all of them out, it's about two spots, two and a half to three spots a year. Two and a half doesn't make sense, but that's how if you average it out, that's how it would be. So to get the interview, you need the grades. So good grades in the top 10% is important. And now the USMLEs, you'll take your step one to get in. It's not exactly called the USMLE, but as long as you're performing well and you can get an interview, that's the most important. But like I said, the key is the interview, and during the interview, that's when you can um, talk about your extracurriculars and how those will come into a surgery training. If you're good at sports, specifically team sports, then you can tell them that, hey, I know what this is all about. I know what teamwork is all about. Because when you are in an oral surgery environment, in a residency, you depend on each other. You have to. You can't do it on your own. You're too tired to do it on your own. So you depend on each other. So it's extremely important that you can bring those things to light, such as your extracurriculars, whether it's, any sort of art form, or sports, anything like that. I know people who've gotten into residencies just because they drew so well, they could literally draw an atlas of the head and neck region. They were that amazing. They had such amazing artistry. So those are important things. And again, I cannot stress, and I probably will say it again multiple times during this interview, that your externships, you have to prove to the person sitting in front of you that you have the knowledge of what oral surgery is, you know what you're getting yourself into, and you can work hard and be a team player.
And one of the things, I'm just piggybacking on what you said, the sense of camaraderie. There are some professions you will see this lot, even though the surgeons might be treating themselves as really bad, but when it comes to stressful events or when they are in the OR, they rely on each other. Or if some trauma call comes in, you can see a very strong camaraderie, like a wingman kind of a situation. And there are some profession where there is high stress and you need to have that team work. And I believe, like from what I observed in US, a lot of people with military backgrounds or sports background are comparatively preferred in these kind of profession. If I'm correct me if I'm wrong, doctor.
I mean, there's always a definite bias because, again, it's how you prove yourself. You just have to prove yourself to say that, yes, I have all the things that you're looking for and I won't quit. But definitely, military is always preferred. Why? Because when you know that somebody who came through a military background, you know that they have the ability to listen to orders
Yes, yes,
and they have a good work ethic.
true.
It's not always true. Again, there's so many variations, but yeah, certain things can definitely help.
So, doctor, when you so now during this time, as you mentioned, USMLE Step One or CBSE and BME exams,
Yeah,
this change happened later on when you were in the residency, right? You were
correct.
already in the. Did you see a difference in the quality of surgeons when this exam was implemented, or from your aspect, like, did you see any difference, like even the vetting of application system?
No, not really. I didn't see much of a difference. It was pretty consistent. The people who are uh, in the top 10% of their classes, and people who are very determined were still the applicants that we were seeing. It didn't change because, again, if they were good at their national boards, or you know, during their dental school, they had good grades. They were also making good grades for those specific exams too.
So here's a difficult question. If a student didn't do well in his academic and now he has to make up, and like for example, during his last semester he just realized life change, he want to be a surgeon now and he want to make up for it. Have you seen any case or scenario or individual who got in even though he didn't do well in his academic world?
Absolutely, absolutely. Anything can be done if you believe in it. It can be done. How did they do it? Um, they and at that point, that's when you have to decide what and how should I make my CV stronger. CV that is dedicated and oriented towards oral and maxillofacial surgery, because that's what you want. You want them to look at a CV and say, wow, does he do anything else other than oral maxillofacial surgery? You know, so the way to do that would be to do internships, 1 year internships, at big programs, with big names who can write those recommendations for you. Because again, now what you've done is, yes, you're looking at the time of the interview, you can say, yes, I don't have the grades that some of these other people do, but look at my CV. Look at my dedication towards this specialty. Those in 1 year internships don't give you anything. You don't get any credit for them. So you have invested 1 year or 2 years or 3 years. There's some people who've done more than one internships, and you have invested multiple years of your life because you want to be an oral maxillofacial surgeon. So now you're proving to the person in front of you who's interviewing you that yes, this is it. I'm dedicated. I'm not going anywhere. And if you don't take me today, I'm going to go back and do another intern year and you're going to see my face all over again. And these were the exact words that I said. When I interviewed at Indiana, these were the exact words that I said, because I did not get into a program the first time. And that is why I did my intern year at LSU. And I just decided that I'm just going to keep doing intern years and barely making any money and living hand to mouth till I got into a residency. And I would not have been able to do it if my family wasn't supporting me.
And
So
that's one of the factors, like when you're already a dentist and now you're not working, there's so much opportunity cost, because you can work as a GP, make a good money and have a balanced life, but you're putting all of that side, your loans aside, and then you still continue to work as an internee, which is quite, I would say, determined and stressful in its ways.
it's a big risk because you're putting all your eggs in one basket. You are saying, I don't care about anything else. I'm just gonna do this and dedicate my life to getting into a residency.
And for those who are listening to this is comparatively quite stressful when you're already in your 30s, you have a family, and you've already suffered once the immigration, because immigration takes its toll. Like, it's a training in itself. And if I'm 22 and I have to do it, no problem. That's why military take teenagers, because you can shape them in any way. But when
Right.
you have to reshape in your 30s, that's a whole different thing. And one of the things I commonly observe, you will, there could be some exceptions, but most surgeons, oral surgeons I've met, I see them physically quite healthy. I haven't seen many with fat bellies for some reason. And that's quite a common pattern that I've seen across.
I think that's because we never really have any time to eat.
Yeah, true. Because the life, like, you're running everywhere, you're picking up patients, you're taking stuff from one building to another. That's how they are. And quite fascinating. So, doctor, my next question was that, and I read this book. It was by a orthopedic surgeon, Christopher Ahmed, in New York. He said, and I want your insight on this, and I think this is helpful for dentists and anybody. He said, in order to perform any good surgery, two things you have to take care is, one is making sure the patient is anesthetized properly, and the patient positioning. And I think that also goes to dentistry as well.
Oh,
If you,
absolutely.
so overall, I want to ask you, what makes a good surgeon? Like, what things can make a good surgeon?
Um, I think to get there, to get to where you want, I think it's pure grit and determination, because it's a tough path. It's very easy to give up, especially for people who are immigrants. So that's number one. That's the first thing. And then the other important thing, again, there's many things that I can count down, but the determination and grit to get through it. And then after that, what makes a good surgeon is being humble. You want to be humble.
Okay, so this is where I'm going to pick your brains, doctor, and forgive me, but I want to add, and from my own experience, and this is I think, something that I've seen all across the globe, as many people I've met. Do surgeons have a God complex? And this is not just for US, even the ones I've worked with in Pakistan.
Yeah, absolutely. I think they do. Um, there's many reasons why they could have that. One of the main reasons is, well, they go through a lot. It's a lot of training. It's a lot of blood, sweat, and tears.
Sacrifice.
So they've given up a lot. and they may be a little bitter about it. So I think that's what it is. But I think what if I have met surgeons in my life who are phenomenal surgeons who've done great things, are world-renowned surgeons, and the best of the best surgeons that I've met have been actually very humble people, very humble. They do understand that they have abilities that some others may not have, but they still remain humble, because we're all just human beings and we all have a lot to learn. We do. And if you stay humble, it makes you sharper. It makes you want to learn more. It makes you want to be more eager to learn more. Those are important things to have. If you think that you know everything as a surgeon, then you're in trouble. That would be your a surgeon's demise. I
And
really do believe that.
I think one of the great thing that you just mentioned, and I think if somebody heard this carefully, the humble you are, the sharper you will be. And it's quite true. I've personally felt in my own life when I'm in my own bubble, I might think I know a lot, but I'm losing a lot because I'm not learning from people because I'm isolating. But that's so, I would say that's so true what you said. Like being humble keeps you sharper because you're listening, you're observing, you're gaining new things. So I think that holds a lot of depth to it. But yeah, the point that you mentioned, the best surgeons are the ones who are the humble one. That's for sure. And as they say, empty vessels make the most noise. There are some who just cover up their insecurities with their big titles. So, uh, how was things for you after you got done with residency? Those 4 years are very stressful. You're waiting to get done. Now you're done, and you're an oral and maxillofacial surgeon in the United States. How did life change for you after that?
um it's tough. um it's a sigh of relief, because you're like, oh my god, I made it through. um it's a big achievement, but at the same time, in many respects, a lot of people feel very broken. um it's just the rigors of training is it can get to you emotionally
And
and psychologically. So a lot of people do great and everything's fine, they do a lot better, but some people have to go through um, a time period where they have to build themselves back up. um, and it's important to understand that that is a thing that does happen. Like I said, the rigors of training is real. um, don't get me wrong, I would do it again and again and again. I know that I gave up a lot. I know that I've sacrificed a lot. I know that my family sacrificed a lot, and nothing can change that. Those years cannot be given back to me. But I love what I do, and that's the only thing that allowed me to get through it, because I really do believe in what I do. I love what I do, and it makes me happy. And that's what you have to do. You have to realize that, once it's just, you just have to finish your training. Once your surgery training is done, then there's only good things that will come. For some, it's slower because they have to build themselves back up. For others, it's an easier transition. Just depends on the residency that you went to, the type of people who are teaching you, and your co-residents. So, but overall, I think it's a good life. I'm happy.
so the point that you mentioned, you have to build yourself up, is I think that's very important because people think you just get in, you graduate, and you make a lot of money. But it's just like how sailors are in the sea for years, and when they come back on the land, they actually have to climatize themselves back to the society. Or for
Mhm.
soldiers who live on the mountains for 6 months, and when they come back, it actually takes them time to climatize with the rest of the human civilization. And I think when you're in that drill for 4 years, staying up all night, running around like you're working, it takes time to climatize back to normal life. So that does make sense. So doctor, my next question was that when you went to uh, fellowship, how, so I've seen a little bit of residency, how residents work. How is fellowship different from the residency life?
For the most part, fellowship is very, very different. Um, so again, it's not easy to get into a fellowship. They're very competitive. Why? Because, well, they're a lot less than they are oral surgery programs. Um, so that's number one. But once you get into a fellowship, if you have the drive to learn, and there's a lot of self-learning at that time, even more so than there is in residency. In residency, you don't have as much time. In fellowship, you may have a little more time to pick up the books and study. But my fellowship experience was fantastic. I was always treated as a peer. I was treated as an equal. And for the most part, I made all the decisions. And because I made the right decisions, they were very happy with following what I wanted to do. So we would see a patient, and I would say, well, this is my recommendation. This is what I think should be done. And these are the reasons why I think it should be done. And sometimes I was right. Most of the times I was right, and they agreed with it. And they said, "Perfect, let's do it this way. Then we'll do it your way." So it's different. Fellowships are normally um, culturally they're a lot different. You don't get beaten down. It's more about, hey, you're here on your own. You're a surgeon now. You're on your own. You're doing this on your own. So yeah, let's try and train you and make you a better surgeon. So it's a much more relaxed environment, but it's still a lot of work.
So one of the things that you taught me when, and to let the viewer know, I met Dr. Khan in Cincinnati and I spent like an hour or so with him, and he told me so many insight things that I can actually write down a book from what he mentioned. And one of the things that you mentioned to me, listen, if you're just going into oral surgery to extract third molar, and specifically at this age, it's not good enough. Like, unless you want to do real big stuff, that's why you want to go into oral surgery, because even uh, GPs can extract third molars. GPR residents are doing that. And I'm just saying, right now, if there's a dentist student, 26, 27 in his dental school, want to become an oral surgeon and want to work for general practice and just extract third molars in IV sedations, what's your advice? Like, because you told me, look at the big, if you want to go in, go big, like go all in. And that's that, if you're going in, have a good reason to go in this this residency or anything like that. So what's your advice on that? Can you share a little bit?
Yeah, no, absolutely. So I want to take a step back and talk about this a little. Like I said, by now I think all the viewers know that it's a big sacrifice. So um, what happens is, as far as maxillofacial surgeons are concerned, the reason why there's this a huge um, you know a fantasy that people have, or this expectation that, oh, I'm an oral surgeon and I can charge X amount of dollars. So from afar, I think it's a beautiful picture. You're a successful oral surgeon, you're taking out wisdom teeth, and you're making a lot of money. That's how it's perceived at the end of the day. But to get to that point where you're the successful oral surgeon taking out wisdom teeth and charging a specialty fee rather than a GP fee, um, you know, well, you give up a lot of family time, a lot of your youth, physically, mentally, emotionally. psychologically. It's a lot of abuse your body takes, your everything, your entire life takes a toll. Is it really worth it? Again, this is just my opinion, but if that's all they're really interested in doing is, oh, I want to be an oral surgeon so I can take out wisdom teeth and place dental implants, then I'm not, I don't think it's a good idea, because somebody who's skilled enough, a general dentist, can take out wisdom teeth, can place implants. And the best part is, if it's a very tough wisdom teeth surgery or an implant case, they don't have to take it
Yeah,
because
refer
they're
them.
not a specialist. They don't have to take those cases that may be litigious. So, that's my take on it. I did maxillofacial surgery, oral and maxillofacial surgery, because I love the oral surgery aspect of it, but I also love the maxillofacial surgery part of it. And I always felt that I was skilled enough that if I didn't have an oral surgery residency, I'm pretty sure I would be able to place implants. I'm pretty sure that I'd be able to take out wisdom teeth. So that's the important thing, to just always keep in mind. Again, this is just my humble opinion, that it's just a smarter idea. Why go through all that rigor? And again, every year that you are in residency, you're technically losing
Losing.
money.
And yep, true. And there are a couple of things I want to tell my viewer. If you're listening outside of US, one of the key things about US economy or dentistry is that once you become a specialist, you're not legally allowed to do general dentistry. If I'm an orthodontist, then I can't practice legally by the book as a general dentist. So in most other countries, people are still specialists and they continue to do general dentistry, but it doesn't work that way. So your REM changes, your domain changes. And so one of the things that I want to let people know what Dr. Khan does is actually he in if you look at from a perspective, like practically, he is a plastic surgeon. That's what he does. He's a dentist who trained himself in oral and maxillofacial surgery, did fellowships, and he's working at a level where, correct me if I'm wrong, doctor, but you're pretty much competing plastic surgeons on a daily basis when you're performing your cleft and lift palate surgeries. Am I right to say that?
Yeah, no, absolutely. I think cleft lip and palate surgery is an area of expertise that is, a lot of people will do it. A lot of specialties perform that. ENTs, plastic surgeons, and maxillofacial surgeons, all three of us can be fellowship trained in these specific in cleft lip and palate. So yeah, no, that's what I have to do every single day.
See,
Uh,
the reason I'm asking this, because if you want to go in a specialty like oral and maxillofacial surgery, then I take really, like, this is an inspiration. Now you're competing plastic surgeon, like you're on the top of your game and you're competing the best. In my head, if I get training this much and then I'm just sitting extracting third molar, I think oral surgeons are trained very hard and they can do a lot of stuff. And competing plastic surgeons is no joke. These, like, you guys are like on the top of the food chain with whatever you're doing. So it's kind of like an inspiration. And one thing I was thinking when you're talking about sacrifice, one thing I observed, normally a conventional DDS student who was graduating from oral surgery residencies were around their 33, 32, 34s, if
mhm,
I'm correct me. And for immigrants who are coming in, usually they start getting into a residency at 33 or 34.
right.
That makes that if they are lucky enough to get in the first place, and then you graduate at 38, 39, so you're competing, like it's a moving target that you're actually chasing, because I think age, health kicks in, family life kicks in, and you're sacrificing all of them and you're competing people who are like 5 years younger than you.
Yeah.
So that aspect, like now since I'm going to be turning 32, I now I realize that time is one of the most valuable things. and you give your youth to any profession, you can be successful.
Oh, absolutely, absolutely. 100% agreed. That was one of the reasons why I have a 5-year-old and a 1-year-old, 5-year-old boy, 1-year-old girl, and we waited till after a residency because I didn't have time and I didn't want to be the father who was never there. So again, important things, we downplay these things, but we all are human beings. We're social animals, right? And then it's important to understand the social aspect of how these residencies can affect us, especially in oral and maxillofacial surgery residency. It's very different. It's a very different culture from plastics or ENT or neurosurgery. Very different culture. Where the expectations are a lot higher for us, because at the end of the day, in the United States of America, maxillofacial surgery, oral and maxillofacial surgery, is a dental specialty. Everywhere else in the world, and other than Canada, it's a medical specialty. So the medical boards own oral and maxillofacial surgery in the rest of the world, while here in the U.S. it's a dental specialty. So when I am doing cleft lip in a palate, or I am doing a nose job, or any reconstructive surgery of the face, well, I mean, the expectations are that I'm going to do it as good or better than other medical specialties. And for the most part, I can tell you, our training is so good that we do it better.
That's fascinating to hear that. And what you mentioned about family life, I and this is one of the reason I take inspiration from you, because I didn't told you this, but my father actually went to Germany to do his doctorate, and he actually had my eldest brother was born when my dad was 36. I was born when he was 42, because in order to do his doctorate in fisheries from Germany back in 1960s, he had to learn German language.
Yeah.
So they made him learn German and then do his thesis in German. So it took him way longer comparatively. And I can actually understand, because when I was growing up, he had a lot of academic things. He was in the academic world teaching as a faculty, but he was getting old. He was 60 when I was 18. And the price that he had to pay, and I could feel it every day. That's something I totally understand what you when you say this. But at the same hand, at the same time, the inspiration that that kid would have, like I get, like my dad wanted something and he did it. He did it. So, and coming from a minority point of view, regardless of like you being in US, like the push of being an, I would say, as an alien, you're so you're an immigrant who's working as a, there hardly any oral and maxillofacial surgeon coming from Pakistan. So you were already one of the few. And then you're a dentist who's actually competing plastic surgeons in the hospital. So that's quite a struggle, I would say, how the fish goes against the waters, against the flow. That's kind of like, for me, it's something like that.
It's definitely a fight. It's definitely a fight, and you decide, you choose which battles you want to pick and when to pick. Um, and right now, my biggest battle is my 5-year-old and 1-year-old. So I'm enjoying that time right now. But yeah, I mean, again, you just have to be laser focused. And again, to anybody who's listening who really wants to do this, you can do it. You can do it. Just don't give up, because there are going to be a lot of hurdles. Just don't give up.
So one other question I had was like, one thing I've been observing in US, a lot of academic institutions over time, because of the legal system and throughout US, the amount of procedure or the level of complexity of procedures that they are performing is comparatively very low to somebody who's doing private practice. whether it's general dentistry or oral surgery. Is that a trend that you saw in front of you happening, or it was even there when you got here?
So, correct me if I'm wrong. You're saying that during residency, the complexity is
Like overall, the procedures that are being done in academic institutes comparatively, they I don't see them doing many complex cases anymore, even though in my head I'm thinking these institutions have umbrella big policies that covers them from malpractice. And on the other hand, I see private organizations, for example corporates, and people who are working on their own, they are doing much more complex cases while being on their own all by themselves in the market. Is that something that was even happening when you started dental school and stuff?
no. I actually I would disagree with that. I don't see that. I really do think that the academic realm, if you want to do bigger cases, if you want to do the complex cases, you need the support. You need the staff. You can't do it on your own. I think the academic realm is the way to go if you really want to do something very complex and complicated. You're not going to be able to. It's just not dependent on the surgeon. It's dependent on the OR staff, the hospital, the ICU staff, everybody, the doctors there. So no, I don't think that's the case at all. I think what's really happening, which is a shame, is that major cases are now going to um, the academics, and the quality, and well, not the quality, but the type of surgeries, more complex surgeries are kind of shifting away from the private practice.
Okay.
That's my thought.
And
uh,
how
Someone like me is very, very, very limited in number.
and how
I don't
was
know how long that's going to last. And again, it comes back to the culture of society. One person up against a litigation, it's too stressful. But it's very hard to sue for an entire university. So that's these are important things to keep in mind. And I agree, and I understand. I totally respect all the people in private practice who are not doing or deferring these complex cases because they don't want to deal with that sort of stress,
makes
and they don't
sense?
have the support.
Makes sense. And how was your practice while working in the Air Force? Like how much complex cases, or how was the structure of practice and when you were working in the Air Force?
Sure. I pretty much could do whatever I wanted. So the more complex the case was, if we had the support, I was allowed to do it. Um, Anywhere you go in life, be humble, be kind, be patient, and people will support you. So I was fortunate that I was able to do whatever I wanted. And so as far as degree of complexity, there was never any um there was no limit to it.
So
So I really it was great for me to have been able to have that military academic career where I could do whatever I wanted.
so here's an this is a question which most immigrants think in their head. Somebody who's coming from a Pakistani background, and you're coming from a Muslim background, and then being and joining academic military setup, did you face any kind of racism or pushback or any kind of discrimination?
Not at all. It's actually the opposite. You'll find more racism and more pushback and more hurdles on the outside than in the military. The military is actually very supportive of multicultural, multi-ethnic, multiracial situations and people. It's just they thrive on diversity. So I had no issues with that at all. And at that time, I also, again, for me, I think the most important thing is, as an immigrant, as a minority, I always knew that I had to put my best foot forward, because if I made the wrong move, then maybe that would put a bitter taste in somebody's mouth, saying, hey, you know what? We don't like these Muslims, or we don't like this Pakistani people. And do you remember him? He was horrible. So it was really important for me to make sure that I'm putting my best foot forward. And you work hard, you're dedicated, and it works out pretty well. But no, I did not feel any of that. In fact, I felt very proud to have served in the United States Air Force because this country's given me so much. So I'm very proud that I was able to do that. And at the same time, I was very proud that I could constantly, you know, educate people on what Muslims are about, or what Pakistanis are about. So it was a good platform for me to talk about who I am and what I represent.
The reason I asked is because somebody who's outside, it the well, with the media and everything, they tend that, oh, the military setup might be the most racist for somebody who's an immigrant. But glad to hear your perspective on that. And I wanted to talk to you about that. The things that you have actually accomplished that requires a lot of, I would say, determination. And how does your parents upbringing, the way they brought you up, and your childhood, what, like your school or your learning at home, what gave you this much determination? Because I'm from the same country as you are, and trust me, not everybody has this much grit. Like they I it can, it is God's blessing, but obviously your parents and your family has invested something special in you.
I think a lot of it was within me. It was innate. I was always very ambitious, but when you have a child and they are, for example, ambitious, or they are good at soccer, then you need to allow them to play soccer. So my family, my mother, my father, always allowed me to make my own decisions, and supported me and believed in me and trusted me. I think that was really important. My relationship to my parents, my father passed away, but was very strong. With my mother, still is extremely strong. Um, they played an instrumental role in my life then and even now. So I think um, what they did well, and I hope that I can do that for my children, was that they were always there for me. I never felt that I needed to go to anybody else. They had my back, and that's kind of how they raised me. Another thing that they always told me was that just don't forget where you come from. And if you read between the lines, it's not just about, oh, don't forget Pakistan, or whatever your country of origin is, but it's actually the fact that don't forget the people who've helped you along the way. You, you can't do it on your own. There's always some source that is helping you. So that is another reason why I joined the Air Force, was because this country had given me so much. How could I give back? And that's what I decided to do. I like, how can I give back? And I'm always looking for opportunity to in this time, in this era in our lives, where there's so much going on around the world, and so much negativity towards certain religions, certain ethnicities and countries. I've always tried to make it um, an objective to actually go out and prove people wrong. So, anytime I get a chance, I will plug in that I'm Pakistani, I'm Muslim. So, but yeah, it's really important. And then, of course, I've said it many times, and I'll say it again. But my wife was instrumental too.
And you're also involved in community work. You go out for mission trips, if I'm right, and you perform surgeries in another part of the world too. How is that, and how did you got involved in that?
Um, this is cleft lip and palate surgery doesn't make any money. at all. You do that because you love taking care of children and babies or anybody with facial differences. And that was something that I love to do. Facial difference is what makes me happy. I do cosmetic surgery, but if two patients came to me, one said, make me look 20 years younger, and the other said, make me look normal, I would be more attracted to the patient who says, make me look normal. I don't want to be bullied at school anymore. You know, so that was something that I always wanted to do as a maxillofacial surgeon at LSU in New Orleans. That's when I decided I wanted to do craniofacial surgery. So all my decisions were made 4, 5, 6 years ahead of time. And then once I made that decision, I stuck to the road, I stuck to the path, and I just kept on doing it. Yeah, so one of the things I love to do, because in the US, a child is born with a cleft lip or a cleft palate, they'll immediately get surgery, they'll be plugged into a system, a hospital system, everything's great. But in developing countries, it's hard, is very hard. You need to have money, but a lot of these people don't have money. They don't have money to eat. So we go there I go and work with multiple organizations, and I spend my time a week at a time, and I go there. We pay our own way. We pay for our hotel, our food, our flights, everything, and then we go for 1 week and do free surgeries. I'm going to one in November in Mexico. So I've had the opportunity to not only go to these mission trips in Mexico, Guatemala, Pakistan, um, but also train a lot of local plastic surgeons, maxillofacial surgeons, and also a lot of plastic surgeons in the US and Canada too.
Nice.
Um, Recently, actually, in this month in September, I'll be going to New Orleans for um, our annual symposium that conference that we have, the American Association of Oral Maxillofacial Surgeons, and I'll be talking about a style of my way of marking a lip to do a specific style of cleft lip repair. So I'm excited about that.
Correct me if I'm wrong. Is Cupid bow one of the most difficult area to reconstruct? Is it?
Oh yeah, no, absolutely. I think every part of the lip is very difficult to reconstruct because again, when you look at the cleft lip, there's multiple issues going on. Biggest thing is, well, the muscle is on one side and another side. It's divided. So the first thing you want to do is get good muscle repair, get good nasal symmetry, because now it's called a cleft um, chylorhinoplasty. Chylo means lip, rhino means nose.
No.
So it's the you do the lip and the nose at the same time. So, but yeah, definitely the Cupid's bow and the
So
vermilion.
so you're practicing, your private practice is right now in Cincinnati, right?
Right.
And what kind of procedures are you doing on your daily or weekly basis in your private practice?
Yeah.
And
So, I mean, I love everything about the whole spectrum of oral and maxillofacial surgery. So, I take out wisdom teeth nearly every day. I take out um, just teeth on a regular basis. I do dental implants, um, whether they're a single molar implant or they're complex zygomatic reconstructions, zygomatic implants, or pterygoid implants. These are specific implants, more complex cases to restore an atrophic maxilla. And then the maxillofacial segment. So I always have divided what I do in different segments: the oral surgery segment and the maxillofacial. Maxillofacial, I do a lot of orthognathic surgery. I do sleep apnea surgery, maxillomandibular advancements. I do the cosmetic side of things, where I love doing rhinoplasties and otoplasties for patients with protruding ears, um, blepharoplasties to make people look a little young. So that's my cosmetic side. I'll do Botox and fillers, things like that. And then the pediatric cleft and craniofacial side. So I do a lot of cleft lip and palate, alveolar bone grafting, anything to do with the spectrum of what is cleft lip and palate.
Well, for individuals who are listening to this is quite fascinating of the amount of procedures and the diverse range of procedures that Dr. Khan is performing. And I do believe the amount of years you have invested in your training to get where you are, that's enormous. And I think it's inspirational again, as I mentioned. So in the end, before we conclude this interview with you, Dr. Khan, if somebody's right now sitting in Karachi, Mumbai, somewhere in Middle East or Venezuela, who's looking at this video and might be in his late 20s, mid 20s, and want to pursue the same route or the same vocation in oral and maxillofacial surgery in United States, what advice would you give to that person right now?
Absolutely. I think the most important thing is when I started my journey, there's nobody else I knew had done it. So nobody from Pakistan had come at that time and become a maxillofacial surgeon. So I had nobody to help me. It's different now. People are coming in, and know your hurdles. Number one, try and get with people who will give you honest advice, whether that's good or, I mean, whether that's something that's uplifting and bright, or they're telling you about all the bad things that can happen. But you need to know. It's not about discouraging anybody. It's about just knowing what the hurdles are. Um, and like I said before, um, it's doable. It's a gamble, no doubt. It is a very big gamble because you've got student loan debt, and you have there's so much uncertainty if you will get in or not. But it's worth it. It really is. If that's what you want to do, don't allow anyone to discourage you. Surround yourself by good people who support you, and try and get in touch with people who can show you what the hurdles are, so that you will stumble, you will fall, but you don't stumble and fall as much. So yeah, that's all I can say. That's just don't give up. Don't give up. You'll want to, but go back and think about why you're here. And that's what I did every single time when I wanted to give up. um, I went back and I thought about it, and I was like, why am I here? What sacrifices have I made? What would my life be if I don't complete this? I don't become an oral maxillofacial surgeon who's trained in the US. And I always came up with the same answer, and that was, don't give up. This is just temporary. This will end, and there will be, a silver lining. So, yeah, don't give up.
Well, glad to hear that, sir. And I think I do have your Instagram page. I'll try to post that in the description if somebody wants to follow and see the cases that you do, or maybe get in contact with you. Hopefully, there won't be a bunch of people just messaging you right after this. But thank you for your time, sir. And hopefully, I'll meet you sometime soon and learn more from you. I appreciate.
Absolutely. Thank you so much for having me. You're doing a great job. So I'm humbled and grateful that I was on your show. Thank you very much.
Thank you. Thank you very much, sir.